Hi everyone, welcome to MD VOD, Your Health Live and On Demand. I'm Dr. John Kennedy, and today we're talking about chronic pain, a condition that affects approximately 20% of the global population and more than 76 million people just in the United States. Lower back pain alone will affect 60 to 80% of Americans and is the #1 cause of disability for those under the age of 45. As we do with every illness, we'll explain in simple terms what chronic pain is, who's at risk, what the dangers are, and the most common symptoms. And later, I'll be joined by Dr. Akash Bajaj to discuss how we diagnose the condition, what he feels the most effective treatments and therapies are, and whether insurance covers the cost. So join us as we simplify what you need to know about chronic pain here on MD VOD, Your Health Live and On Demand. In order to understand any disease, it's important to know the anatomy. Today, we're talking about pain, which involves the brain and the spinal cord. Pain receptors are located all over our body. They're in our fingertips, our joints, our head, the lining of all our organs, and our GI tract, just to name a few. Sudden pain involves a reflex arc. For example, when we injure our index finger, like smashing it in a car door or accidentally placing it on the stove on a hot burner, a signal is sent from the pain receptors in our finger up into our spinal cord, then to our brain, and then back down through our spinal cord, and then a reflex to remove our finger from the painful stimulus. Chronic pain is day in and day out pain that typically involves the back and our joints, like our elbows, our hips, and our knees, which is the kind of pain we typically see in arthritis. Stay tuned for more information about chronic pain. Welcome back to MD VOD, where we're talking about chronic pain, and we're joined with chronic pain expert, Dr. Ashok Bajaj. Dr. Bajaj, welcome.
Thank you very much.
Hey, thanks for being here. Hey, so what is chronic pain?
Well, chronic pain really is defined as pain persisting for greater than 3 to 6 months, depending on the text that you're reading in the literature that you're looking at. Chronic pain is very different from acute pain. The biggest difference is with acute pain, we tend to have an inciting incident. With chronic pain, that inciting incident is not present, but the pain remains. It's very debilitating.
So pain is something that affects so many of us, and one of the common places that we see pain is in the back and the neck. Why is our back such a vulnerable place to have pain?
You know, there is so much anatomically going on with the spine specifically. There are several different areas where the back can become compromised, leading to chronic pain. Usually acute pain first, followed by chronic pain. Now, if we take a look at this, we can see the nerve roots themselves are very potentially viable to any sort of compression or degeneration from the discs behind them. The discs can become a source of pain in and of themselves, as well as causing nerve root compression. This is typically what is referred to as sciatica or a pinched nerve. Now, additionally, at the posterior aspect of the spine, we see these vertical joints. These joints are called facet joints. These joints, like any other joint in the body, can become arthritic. Those arthritic changes can lead to chronic pain. And of course, there's also the largest joint in the body, which is the sacroiliac joint. We can't see the complete joint here in this model, but it's located right about here. And this joint, again, like any other joint in the body, can succumb to arthritic changes, degeneration, and chronic pain.
So that's the kind of pain that you would get when you're riding around in your car all day and you feel that pain in the back, low back and in your seat. That's sacroiliac pain or a pinched nerve that Dr. Bajaj talked about. Dr. Bajaj, what are some of the risk factors for chronic pain? And are there any genetic risk factors, biological risk factors that might increase your risk?
Well, the more knowledge that we gain about chronic pain in this day and age, pain management in general is a very young field in medicine. The amount of data that we have is small, But as we gain more and more information, we're learning, yes, there are several genetic factors involved. There are several risk factors involved as well. And usually, chronic pain is never attributable to just one specific cause. It's usually partially genetic, partially environmental. Perhaps there's a degenerative change as well, or a traumatic episode, or which is a clear inciting incident. So usually it's a combination of several different factors.
And when someone comes to you, let's say it's a shoulder or a back, how do you make the diagnosis?
Well, there's several modalities that we use. The history and the physical examination always take precedence. They will continue to do so with chronic pain. Really obtaining an appropriate history, almost like a detective from a patient, can virtually guarantee you will get important information on where this pain is coming from, a potential inciting incident, and other factors that are important like family history, genetic components, etc. Physical examination, again, is very key. Much of what we deal with and we talk about is anatomical, it's structural, and it's mechanical. So that being said, if we're able to reproduce the pain, be it in this, let's say, for example, the cervical spine, the thoracic spine, or the lumbar spine, then we're able to further pinpoint specifically where the pain is coming from. If we can do that, of course, we can move more towards a diagnosis and a treatment. And of course, imaging. Imaging is incredibly important with pain management. We need to literally see if there's nerves being compressed, if there's discs that are degenerated, further compounding the issue. If there's, for example, a vertebral compression fracture, or perhaps there's none of the above, and this is more of a cryptic neuropathic disorder that we're dealing with.
And once you make the diagnosis, let's say, again, it's based on your history of where the pain is coming from, which tells Dr. Bajaj and other doctors how to treat your pain. For example, if it's in your neck or your back or your knee, it's going to be treated a little bit differently. How do you start treating someone's chronic pain?
So chronic pain, again, the way we would treat that is first establishing an appropriate diagnosis. Once that diagnosis has been established, we would treat this much as pain. Chronic pain has multiple pathophysiologies really leading to the presenting picture.
So a bunch of different causes.
That's right, a bunch of different causes. We need to treat each cause individually. By treating each cause individually, we can treat the entire person as a whole. For example, medication management is one side of it. Non-invasive, more conservative preventative measures like physical therapy, sometimes when appropriate chiropractic therapy as well, and general lifestyle changes. And then interventional therapies are sometimes indicated as well. So this can include minimally invasive, fluoroscopically guided injection therapies, other cutting-edge therapies such as platelet-rich plasma or prolotherapy.
Okay, so let's say, let's use back pain as an example. That's probably the most common type of pain that I see in my practice. Let's say you have back pain, you go to your office, the patient goes to your office, you take a great history and physical, you make a diagnosis of sacroiliitis. What medications would you start treating someone with?
So sacroiliitis really is an inflammatory state of the joints. That's ultimately what arthritis is. It's underlying inflammation at the joints. The reason it becomes symptomatic is these inflammatory mediators tend to accumulate and collect, causing an inflammatory response, leading to activation of the pain pathway, which leads to pain. So how do we treat it? We want to treat the underlying issue, the inflammatory process. So anti-inflammatories are the primary mode of treating this. There are several different mechanisms for delivering an anti-inflammatory to a patient. First and foremost would be an oral medication, an anti-inflammatory. Some of the more common ones are ibuprofen, Motrin, Naprosyn, Aleve, etc. However, this needs to be weighed, and it's a very case-by-case basis, but this needs to be weighed with the potential systemic side effects or the side effects that the entire body experiences. Some patients are just not good candidates for oral anti-inflammatory medications. And in that case, we would move more towards a spinal injection if appropriate, or a joint injection if appropriate. By doing that, we maximize the amount of anti-inflammatory we can deliver to the appropriate area and minimize the body's systemic effect or systemic exposure, thereby leading to the systemic effect.
Wow, it's a great answer. It's great advice. You know, some of the medications, the common medications that we use for pain, are actually pains that require more and more to treat our chronic pain. And those drugs can be addicting. How do you prevent that from happening, and what are some of those drugs?
So the class of medications you're referring to are opioids, or narcotics as they're commonly called. Narcotics are very complex medications to use on an acute and chronic basis. You know, let's say you break an arm, you take a narcotic, very commonly a Vicodin or Percocet, for example. Your arm heals, the pain goes away, you stop the medication, you go about with your life. With chronic pain, the picture is completely different. Now we run into a picture where a patient may take this medication on a regular basis appropriately because they are experiencing chronic pain, but your body tends to develop a tolerance to these medications. Once that occurs, you need more of the same medication to achieve the same baseline pain relief. Now, of course, as we increase the amount of these medications, there's several dangers that are involved. One is something more common like Vicodin or Percocet is typically combined with Tylenol. And the Tylenol can be very, very taxing on your liver. So this can lead to liver failure or other sorts of liver problems down the road. The other issue, of course, is addiction. This really needs to be clarified, however, because addiction tends to be a very large umbrella statement, but we're really looking at addiction, pseudo-addiction, dependence, and tolerance. So addiction tends to be more of a psychological phenomena, where you will risk life and limb to obtain a medication in order to obtain a certain euphoric effect, for example. Now, pseudo-addiction is very interesting because pseudo-addiction is a physician under-treating a patient's chronic pain problem. So that patient legitimately needs more medication and they're manifesting as a pseudo-addict or an addict because they're maybe calling in for early refills, etc. To differentiate between those two ultimately takes a lot of experience and the ability to really tease that out.
So I heard you mention one of the newer therapies available for pain. I think I read recently about Kobe Bryant getting something really interesting that I'd never heard of before. What are those therapies that are available now for chronic pain?
So what you're referring to is PRP, or platelet-rich plasma therapy. Now, platelet-rich plasma therapy is incredibly exciting for the pain management community. And the reason for this is platelet-rich plasma therapy literally accentuates the inflammatory response to accelerate the healing process.
So is it the anti-inflammatory like blood products that we have that treat the pain? Is that what we're actually doing?
That's exactly what we're doing. So platelet-rich plasma therapy, in essence, is extracting a patient's autologous blood or their own blood, utilizing just the platelets from that extraction, injecting the platelets back into the affected joint, and those platelets, in essence, act as a recruitment to the current inflammatory response that's taking place, which can accelerate healing.
That's great advice. Interesting stuff out there. What other than the new therapies available for chronic pain, are there any stretching or non-medical sort of methods that you'd recommend for chronic pain?
The good news, the bad news and the good news about chronic pain is proactive care can definitely mitigate our overall prevalence and incidence of chronic pain. Now, for example, with sacroiliitis or lumbar spine pain or low back pain or sciatica, which is commonly seen, core strength training is key. If one can strengthen their core, in essence, they can stabilize their spine, which can mitigate or prevent any sort of slipped discs or malformations of the spine if one is prone to have these.
So you know, exercises that build your core sort of protect your spine from injury. That's another great take-home point. And chronic pain is incredibly expensive. We've named it the numbers at the top of the show. Is there anything you could recommend other than what you've already mentioned about prevention? Is there anything you recommend that would actually help us decrease the cost of this disease?
Yeah, well, again, proactive care is key. Morbid obesity has a direct relationship to chronic pain. If you think about it from a mechanical or a structural standpoint, your spine has been built for your body at your relative ideal weight, give or take 10 to 15%. Now, if a patient is morbidly obese, they are in essence carrying around 2 or 3 heavy pieces of luggage on the same equipment. Ultimately, this will accelerate degeneration. So maintaining appropriate body weight, maintaining appropriate physical fitness, again with focus on core strength training, is key.
So Dr. Bajaj, does insurance cover cost of most treatment and medications for chronic pain?
Most insurers realize the importance of dealing with chronic pain in an early fashion. So the answer to that is yes. The majority of chronic pain treatments are indeed covered by most insurances.
Outstanding information. I hope you've enjoyed this. Thank you, Dr. Bajaj, for joining us.
Thank you for having me.
Outstanding.
Appreciate it.
Up next on Apple a Day, learn ways to prevent chronic pain. We're back with an Apple a Day and common sense tips to minimize your everyday aches and pains. If you suffer from chronic pain, you need to know that it doesn't have to run or ruin your life. It's important to understand your pain and learn all you can, reduce the stress in your life, exercise and stretch, and share with others experiencing chronic pain. Understanding your pain is the first step to reducing it. Also remember that our bodies and minds are connected, and reducing the stress in your life will help you decrease your pain. Deep breathing and other relaxation techniques can really help. Exercise and stretching will also help you achieve a stronger body and help you defend against injury and pain. Make sure to talk to your doctor about a specific exercise program that's safe for you. Chronic pain can sometimes make you feel isolated and alone, but remember there are so many people in the exact same boat. And that's why chronic pain support groups can be a great way to get this important human contact. Finally, when you take action and follow these steps, you'll have a happier and more productive life. Be sure to stay on top of the latest news about chronic pain research at cdc.gov, because the more knowledgeable you are, the healthier you will be. Thank you very much for joining us. I hope you found this information about chronic pain helpful. I'm Dr. John Kennedy, and you're watching MD VOD, Your Health Live and On Demand, here on EmpowerMe.tv. And don't forget to like us on Facebook, follow us on Twitter, and share us with your friends and family. And for any episode you might have missed, they're now available on EmpowerMe.tv's website and the YouTube channel. So be sure to leave us your comments and questions about any of the diseases we've discussed. We'll see you next time on MD VOD.